move on in this theme and bring in informatics. Now, informatics is extraordinarily successful in its own right, doing what you heard is the kickoff core. But I've added this to development because there's such a burning desire for informatics to be informative across all the disciplines and through the life cycle of career development, that we wanted to really focus on plans for informatics to build out career development. So, Frank, is that you?
Yes. Can you see my slide?
Yes, we can.
Okay. All right. Thanks, Ray. As Ray just mentioned, we've really been focusing on the service aspects of the informatics core, and in particular, implementation of the systems that we're going to be using to help to support research. But we did start to focus on the training needs. One of the recommendations from the external advisory board was that we need to begin to focus more on training a workforce to support clinical informatics as we enter this new era where we're going to have a universal electronic medical record that's going to be producing data that's going to be supporting really everything in the CTSA. So it's very much a work in progress, and it's also because we're starting without a lot in place. We're planning to use a phased approach. So one of the earliest things that we have talked about doing is expanding some existing informatics electives into more extended fellowship opportunities. David Foran has had an informatics elective for several years that have been offered to pathology residents and radiology residents in various aspects of imaging and bioinformatics. And one of the people who has formerly taken one of these electives actually converted this into a fellowship and eventually became board certified in clinical informatics and joined the faculty. So we'd like to, as a first step, begin to open these electives to people outside of just those two departments and expand the areas that are covered, in particular covering clinical informatics. There's a real shortage of people in the university right now who have experience and training in clinical informatics that is supporting the actual clinical operations. And there's a great need for them, but there's also a great deal of interest among people who currently work here, particularly among some of the clinical staff throughout the medical practices and particularly in the health system. And the health system has some informal training programs where they mentor students from allied health professions, for example, in pharmacy. They also have relationships with the nursing school to provide on-site informatics training for nursing students. And that's a group that we will be able to recruit in the long term for increasing our workforce. Like many other people have reported today, we are looking at a digital badging program. So this would provide a way for people to acquire a skill in a particular area and to have that recognized without having to enroll in a formal degree program in that area. And so I think we need to work very closely with the other cores, particularly the workforce core, to implement that. We also would like to take advantage of the course offerings that we have in the School of Health Professions, which has a number of training programs that turn out people who end up working in hospital IT and other healthcare practice IT. Longer term, we'd like to begin looking at full fellowships in both clinical and bioinformatics. Some of these people will focus on clinical service, for example, becoming informatics staff, CMIOs, people filling that kind of role. But also, we need people who will support research in the clinical environment. Eventually, if we have enough of a critical mass of people, we would like to pursue informatics research, which is really different and separate from informatics that's supporting clinical research. And then finally, we are looking at opportunities to provide mentoring for our NJX partners from our affiliates, for example, NJIT, in some informatics methodologies, which we don't have a strength at Rutgers. So the next slide shows some examples of this. Machine learning, natural language processing, both of those are areas that are in use and being explored at NJIT. And you've seen examples of some projects, some collaborations between Rutgers and NJIT. Also social media analysis, management of large claims databases, which Steve Crystal reported on earlier, and merging of claims data with clinical data. Another skill that's greatly needed is database management and data analysis. And we're going to need more and more people with those skills in order to begin working with the large number of data that we are going to be generating. There are a number of bioinformatics topics that I've listed here. We have a good foundation, but there'll be a need to train people in that area. Other areas are data extraction from EHRs. And, you know, an example of this is the Combat COVID project that we're doing in the collaborative that's based at NYU. There are going to be many more opportunities of that sort, and they all involve extracting data from EHRs in a common standard format that can be shared with other collaborators. And then finally, we want to optimize our EHRs to support research. And this will involve a close collaboration, I think, between NJACT and the clinical enterprise so that we make the most use of our tools, such as the Encore clinical trials management system and also the various mechanisms that we have to capture data in the clinical setting. So now for the next slide, I'd like to turn this over to David Foran, who will tell you about a program that he is participating in Botswana. So David, are you there?
Yeah, I'm here, Frank.
Okay,
so,
thanks.
Thanks very much, Frank. I appreciate the introduction. I'm going to focus a little bit more on an outreach program that we've undertaken with the Global Health Institute. And we're developing software to support web-based medical education programs and near-time telepathology applications. So in September of 2019, a team from Rutgers, including myself, Tina Mayer, and Rick Marlink, actually visited with attending physicians and pathology residents at University of Botswana. And while we were there, we had an opportunity to visit 2 different hospitals within the Botswana healthcare system. And we all observed current workflows, resources, and staffing. And based upon our discussions subsequently, we decided, along with our colleagues at Botswana, to set our focus on 3 well-defined projects. And specifically, we wanted to implement and adopt low-cost, high-fidelity digital pathology technology, design, develop, and deploy point of contact computer assisted diagnostic tools, and develop a Google-based cloud dynamic database of gold standard consensus graded cases to query against to provide asynchronous clinical decision support and training to pathologists and oncologists in Botswana. So if you can go to the next slide, please, Frank.
I think Frank stepped away. Can you just describe it?
Sure. So although the pandemic presented a host of different challenges for us that really jeopardized the entire project, we really didn't allow that to derail our efforts. And as an example of one of the projects underway, we've been working closely with the Department of Pathology to design, develop, and implement a dynamic pathology quiz bank that features live virtual telemicroscopy, automatic scoring, and a growing database of oncology cases to be used in training medical students, residents, and practicing pathologists and oncologists, both locally and in Botswana. And we really envision this tool as a means for executing continuing medical education and remote interactive consultations going forward. And I can just stop right there.
Oh, do you want the next slide, David?
Yeah, next slide, Frank.
That's okay.
Okay.
Okay, great. Wonderful. All right. Is there more, Frank? Oh, there we go.
No, that's the last slide, Ray.
Yeah, that's wonderful. You know, this is a great start to the informatics career development piece. There's so many moving parts here, but it is really an incredible opportunity. In the informatics group, there's an entire discipline around clinical decision making, right, Frank? And the informatics associated with clinical decision making. It might be.
That's right.
It would be a thrill of mine as in the next couple years, what we're going to find are K awardees and T awardees who are going to base their careers in this space. It is really the frontier right now of where we're heading. And I applaud informatics stepping up and really trying to carve a niche out so that informatics could be a discipline that everyone could build their careers around. So thank you. That was really very informative. So that ends this theme. Really a lot of progress. I'll take a couple moments, Cindy, from the ethers of evaluation. Would you come in and what do you see? What do you want? What's your wish list?
Sure. Let me just, I know we only have a couple minutes, so I'm not going to go through slides, but I will simply just pull them up quick so I don't forget to just mention anything. Okay. Obviously, you all.
If you could mute your mic if not
On the way
speaking.
to the end.
Go ahead. Ed, Cindy, so. Great. Now it's quiet. Oh no, we lost Cindy. Yep, there you go. All right. You're still on mute.
All right. Sorry about that.
No worries.
I'm not going to bother. Okay. So couple things. I think that there's so much happening and there's so much that everyone wants to do, which of course is terrific. But to me, definitely think we need to think about prioritizing a little bit more within cores and across cores. I'm sure you all know that, but I'm thinking about it in terms of evaluation and collecting data. We definitely want to make sure that we're capturing what we can and what you all feel is most important within your cores. I also think that we might want to consider assessing and looking at our administrative core, sort of looking at collaboration, looking at the work between and among the universities, sort of the effectiveness and efficiency, and if there's different ways we can structure things and work together to be even more efficient and effective. I really would love for us all to align measures where possible so we can consider outcomes and impacts across cores. Of course, to me, conducting more innovative evaluation work where possible, either within a core or across cores, would be terrific. And I think there's some possibilities that I've heard today. And also based on our external advisory board report, I think we all need to keep in mind the focus on impact and impact beyond sort of our outcomes, right? So they're really thinking about more the macro vision, more impact in terms of an increase in community health in the New Brunswick area, for example. So just a couple quick thoughts. I know we're way behind, so I will stop there.
All right. Well, thank you, Cindy. And I know you're going to be in contact with all the leads to really describe in more granularity the evaluation process. So we just finished that core. I would recommend a 10-minute break